Worldwide, around 500,000 women are diagnosed with cervical cancer each year, and more than half of them die of the disease. In the Philippines, 12 women die of cervical cancer every day. But first, what is cancer? Cancer is a disease in which cells in the body grow out of control. When cancer starts in the cervix, it is called cervical cancer. Infection with the human papillomavirus or HPV causes cervical cancer. HPV is so common that nearly all sexually active men and women get it at some point in their lives. In most cases, HPV goes away on its own. But when it doesn't, it can cause problems like cervical cancer. Men pass it on to women through sexual intercourse without even knowing it. In most cases, there are no symptoms during the early stage of cervical cancer. Symptoms like spotting in between periods, bleeding during or after sex, pelvic pain, and unusual heavy discharges show only when the cancer is at its late stage. Who is at risk? Every woman who has had sex is at risk, regardless of age, status, race, or sexual practices. What should we do? Women from age 21 should make it a practice to see an OB-GYNecologist for a Pap smear. The Pap test looks for changes in the cells of the cervix that might lead to cervical cancer. With early detection, treatment is possible. 2 vaccines are also available in the market. Both vaccines are highly effective in preventing infections with HPVs type 16 and 18, 2 high-risk HPVs that cause about 70% of cervical cancer. However, since the vaccine only covers some high-risk types of HPV, experts still recommend that women get a regular Pap smear even after vaccination. Maintaining a healthy lifestyle is also a must. Practice safe sex. Avoid having multiple partners because this increases your risk of HPV infection. But remember, even with just one partner, a woman is still at risk. Protect yourself. Protect your loved ones.